Good afternoon. Welcome. This webinar is a collaboration between the United States Department of Veterans Affairs, Center for Faith-Based and Neighborhood Partnerships, also known as CFBNP, and VISN 7 Chief Medical Office Special Populations Program Office. My name is Nicholas Walters. I am one of the outreach specialists in CFBNP. I will be your moderator this afternoon. Everyone's mic has been muted. If you have any questions during the presentation today, please type them in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation will be available to everyone that registered for this webinar. This is a live recording. I would like to thank Ms. Mary Lou Pittman for this collaboration. We are grateful for your time today. Before we get started, I would like to introduce Mr. Conrad Washington, the Director for the VA Center for Faith-Based and Neighborhood Partnerships.
Hey, thank you, Nicholas. I appreciate it. Thank you all for coming and joining us today. I want to also echo what Nicholas mentioned and thank Mary Lou for taking time to share information on the topic today because it is important. But I also want to thank you all for tuning in because you could be a lot of places. We have a lot of webinars and Zoom calls going on, but I truly appreciate you stopping by the Department of Veteran Affairs Center for Faith-Based and Neighborhood Partnerships today. Here in this office, we have webinars just like this 2 to 3 times a month from a wide array of veteran-centric topics, ranging from suicide prevention, as you saw the video today, veteran benefits, veteran homelessness, survivors assistance, and many more. So if you're interested in having or collaborating with us or partnering with us to have a video, to have an actual webinar, please join us. We'll give you information at the end so that you can connect with us. But I also want to take a few moments before we turn the floor to Ms. Pittman to share with you what we all know is a growing concern right now, and that's the vaccination of our population. So we have vaccinated about 63% of adult Americans in communities across the country because the virus is in retreat. We know that because people are getting out, and CDC guidance has authorized many of us to not have to wear masks in public. But the fact remains, if you're not vaccinated, you are at risk of getting the virus or spreading it to someone else. And so I'm gonna throw some statistics at you, not to mess you up, but just so that you can be kind of put in your brain what's going on here. So 72% of Americans, right, age 40 and over, have at least one shot. That's a good thing. But our young Americans, they remain at risk. And so we have to find a way to reach them. And the key is so that we can go into the summer with the peace of mind, knowing that everyone is protected and they don't risk spreading the virus to others, right? So that's why the current administration in the White House is launching a month of action, right? This is not just another initiative. This is important, a month of action to mobilize an all of America sprint to get more people vaccinated by July 4th. So vaccines are going to be free, as we know, available in convenient locations near you. You can be in and out in as little as 15 minutes. And we partnered with community leaders, faith partners, businesses, celebrities, athletes, colleges, and thousands of volunteers will participate in a nationwide campaign, right? It's called a month of action. And part of the month of action, it's going to be even easier to get vaccinated. Why? Because child care providers are watching kids for free. Our parents get the shot. Vaccines are going to be available at barbershops, baseball games, and NASCAR races. Pharmacies will also be open 24 hours on Fridays. And the administration is doing everything they can to roll this out by leading in canvassing phone, banking, texting into areas with low vaccination rates. Coordinating vaccine events, more than 100 organizations have committed to hosting over 1,000 events the first weekend alone. So we're excited about what's going on. We want you all to join us. But I just want you to be aware that this is a national campaign. More than 50 mayors across the country are competing to boost vaccination rates through canvassing, local partnerships, and incentives for people. More than 230 colleges and universities are taking the pledge, right? Businesses like Anheuser-Busch, Kroger, United Airlines, and we can go on and on. They're all offering adults free beer and drinks on July 4th, the chance to win $1 million and free first class flights, right? So the bottom line is we need everyone to help. We need you to be aware. My team and I today will be sending out information in detail about the 81,000 sites that are available to take the vaccinations, the walk-in vaccinations, extended hours at many pharmacies in the month of June. And we're going to tell you how to find out where the nearest vaccination site is. And you can text 438829. Again, that's 438829 to get a text back with vaccine sites near you. And also, we will be providing that same text information today as we send out to our partners. So I know I've said a lot today, and I appreciate you listening. But right now, we're going to go ahead and continue our webinar. And Ms. Mary Lou Parton, I'll turn it back over to Mr. Nicholas Walters. Thank you.
Thank you, Mr. Washington. At this time, I would like to introduce to you Ms. Mary Lou Pittman, who will be providing our opening remarks for today's presentation. At this time, I give to you Ms. Mary Lou Pittman.
Good morning or afternoon for some. It is indeed an honor and privilege to be here with you today. I want to thank the Center for Faith-Based and Community Partnerships for inviting me here today. I am representing the CMO's office out of VISN 7. VISN 7 has 8 facilities that we cover. They are in Alabama, Georgia, and South Carolina, and we have over 50 community-based outpatient clinics, and we're growing. We have partnerships with our vet centers, and we also work closely with our VBA. I am the Special Populations Program Manager at VISN 7. And I have 5 programs that fall under the umbrella of special populations. And they include women's health services, traumatic brain injury, transition and care management, which is now known as military post 9/11 military to VA case management program. I also have the LGBT program, which I'll be spending a good amount of time speaking to you about today. And the last program is the Intimate Partner Violence and Abuse program. I want to start off with a story, and it's dual purpose in nature. I get nervous when I start speaking, so sharing a story helps to bring my nervous level down. So there was a woman that was walking on the boardwalk, getting ready for the day of work. She had a presentation to make. As she's walking down the boardwalk, she sees a figure, and it looks like the person is dancing or exercising. It piques her interest, so she walks, a little faster because she wants to see what this person is doing. As she gets closer, she notices that this person is not dancing at all. They're actually picking up starfish and throwing them back into the ocean. And the person continues to pick up starfish and throw them into the ocean. And she finally yells out, "What are you doing?" And the person says, "I'm picking up starfish and throwing them in the ocean." And she replies, "But there are so many. How can you make a difference?" And the person stopped, picked up another starfish, looked at her and said, "It makes a difference to this one." And he threw it back in the ocean and continued to do that. Every day, each and every one of us has an opportunity to make a difference in the life of another person, and it makes a difference to that person. So I'm getting a message that says to turn off my virtual background because it's causing an issue on the computer. I will do that, but I promise to come back on halfway through the presentation because I think it's important for those on the webinar to also see their speaker. So bear with me. Oops. All right, so today's topic is LGBT within the VA. I already told you a little bit about myself, but I will add that I am the wife of a Marine, retired after 21 years, and my son also served in the Air Force. So for me, the work that I did in the Department of Navy and the work that I do now at the VA is an extension of who I am and who we are as a family. So what is LGBT? LGBT stands for lesbian, gay, bisexual, transgender. And the plus in LGBT stands for gender identities or sexual orientations that aren't listed here. Now let's be clear, when you hear LGB, that relates to a person's sexual orientation. Transgender, the T, relates to a person's gender identity, and there is a difference. A Kansas native, Gilbert Baker, who was a U.S. veteran, designed the flag that you see on the screen. And each of the colors represent something. So if you look at the slide here, you'll see that purple is spirit, green is nature, orange stands for healing, red is life, yellow is sun, blue is harmony, and the pink is for sexuality. So why the rainbow? This is recognized, highly recognized, not only in the US, but around the world. And it was designed in 1979. So it is part of the identity of the LGBT community. The flag that you see below is the transgender flag, and that was created in 1999 by a trans woman named Monica Helms, who was also a veteran. She served in the Navy. Now, let's talk about some common terms for LGBT. I would say that I am an ally. I'm a heterosexual woman that supports LGBT rights and goals. Asexual is experiences little or no sexual attraction to others. Birth sex, that's the gender that's assigned at birth based on the external anatomy of the baby. Bisexual, a person that is physically and emotionally attracted to all genders. And cisgender is a person whose sex birth matches their gender identity. Why is it important to know these terms? Because you want to make sure that when you're speaking to someone that you are using the correct terminology. Some other common LGBT terms include gay, a man that is physically or emotionally attracted to the same gender. Gender fluid, a person that floats on the male and female spectrum. A gender identity, the gender that a person identifies as. So you heard me say earlier, I am a female, I am an ally, and I also have pronouns that I prefer that be used. Closeted. Some of you have heard this, and that's a person that is not open about their sexual orientation. And folks, it is not our responsibility or right to share someone else's gender without their permission. Other common heterosexual, attracted to the opposite gender, homophobia, discrimination or hatred of people who identify as homosexual. Lesbian, a woman who is physically, emotionally attracted to the same gender. And the pronouns. So you will see on people's name tags or on their signature line that they'll put he, him, she, her, they, them, sie, her. Those are pronouns that people use to identify who they are. So if you look at my signature line, you will see she, her. Now let's go back to homophobia. The VA has no tolerance policy on homophobia. However, we strive to not discriminate or promote hatred of any identity whatsoever. And we're working really hard to have an inclusive environment for all of our veterans. When speaking to veterans, don't assume their gender or pronouns. Some veterans will flat out correct you and they'll say, I want to be called whatever, X, Y, or Z. I want to be called, use my pronoun, she or her. Be careful when using pronouns that you've been told are what the person would like to be called as, because you could be wrong. Other common LGBT terms include transgender, a person whose gender identity doesn't match their birth gender. A trans man, a birth gender woman whose gender identity is male. Trans woman, a birth gender male whose gender identity is female. So let's be careful not to call people he, she, or that, or it. It's not appropriate. And you want to be treated with respect, so we want to make sure that we're treating others with the same amount of respect. Now, in terms of gender, sexual orientation, we've highlighted on some of these already. And so I'm going to move to some veteran facts. There are about 20 million veterans in the United States. 1 million about are estimated to be LGBT, and 65,000 of them are considered to be active. At least 134,000 are transgender, and of the 134,000 of them, 15,000 of them are in active service. The VA, we don't collect sexual orientation or gender information from veterans, though the information will be collected when the new charting system comes on board. Approximately 52% of our veterans choose to receive their care outside facilities, especially our LGBT population. We're working on that. If you served you should come to the VA to receive your care, just like any other veteran. So why do vets choose to get their care elsewhere, LGBT vets? Some have told us that they anticipate that they'll be discriminated. So based on past experiences in DOD and with their commands, they expect that that might be translated when they come into the VA. You know, the passage of don't ask, don't tell. We saw folks that were discharged dishonorably, so they didn't feel as though the VA would be a welcoming place for them. I want to tell you a little bit about our program in VA. So every facility has a designated LGBT VCC. VCC stands for Veteran Care Coordinator. While these are collateral duties, the people that are assigned to that role take that role very seriously and are oftentimes allies and ready to step up to support our veteran population. They help coordinate care. They help, a person navigate their care at the VA. They help to set up services. Sometimes it's a warm handoff to a mental health provider, a warm handoff to our chaplain services. It's a warm handoff to a clinical provider. So in 2011, Don't Ask, Don't Tell was repealed. That meant that a lot of people could finally get a sigh of relief. So we went through this one, which is why do some of our vets choose to get care elsewhere, our LGBT vets, because of past experiences. So here's an important factor here. We want to encourage veterans to get their care at the VA. And we are creating and frequently updating our policies for LGBT care. And we're implementing training for all of our staff members. And we're making sure that we're hanging up signs to notify veterans that that the VA is a safe and inclusive space. As you are aware, June is Pride Month, and at all of our facilities, we have programs that are going on throughout the entire month. And our national office has a month of activities that are going to be offered for VA and for those outside of the VA. So what about our mental health for our LGBT female veterans? We know that 31% of our LGBT female veterans have experienced some sort of sexual assault. That's pretty sad. So they come into care with a higher rate of depression, anxiety, low self-esteem, having experienced sexual assault, domestic violence, alcohol abuse, smoking, and suicide attempts. We know that 2 times higher the rate of suicide attempts and 2 times higher the rate of depression. The best way to protect our veterans is to make sure that everything they need when they're at their lowest point. Please, if you leave here with one thing that I've said, write down this crisis line number: 1-800-273-8255, and then #1. This is a 24-hour service, and a veteran can call whenever they need to. And through the crisis line, we'll be able to get them the support that they need. How about mental health for our LGBT males? 16% of LGBT male veterans report being sexually assaulted by a coworker in the military. Not often talked about, but it does occur. So let's take a look at when they come into care, what they're bringing along with their physical concerns. They're 3 times more likely to have depression, 3 times more likely to have eating disorders, 3 times more likely to have suicidal ideations or attempts. They too come in with a high rate of anxiety and stress, low self-esteem, alcohol abuse, substance abuse, violence, and smoking. So we need to take a look at the whole person and treat the entire person, regardless of how they identify. If they served in the military, then they've earned the right to get their care at the VA. What do I want to emphasize here? And if you guys were not muted, I'd have you repeat it. Let's look at that crisis line again: 1-800-273-8255, #1. It is so important that our community have that number readily available and be able to share it with congregations, with, folks that you work with in the community, with our volunteers who are veterans. How about our mental health for transgender veterans? Transgender veterans have worse mental health and physical outcomes on nearly every measure. They have a higher rate of depression, homeless, smoking, anxiety, violence against them, alcohol and substance abuse, and increased suicide ideation and attempts. I'm not going to repeat the number again because I know you have it. Now let's talk about having that awkward conversation. A lot of people feel awkward when they're asked questions about their sexual orientation. But because it's awkward doesn't mean that we shouldn't ask the question. And in the realm of healthcare, it's very important that we do that, because in order to provide whole health care, we've got to know the person. So the best way to do it is just to ask. We found that many veterans will appreciate your willingness to be inclusive, and it helps them in establishing a more trusting and open relationship. So what if I ask and a veteran gets upset? Then your response could be, "I'm very sorry I upset you, but this VA is open and accepting of all veterans who walk through our doors." You could even add, "It's important for us to get to know you so that we can provide you the best care possible." Just because someone served doesn't mean that they come in the door with the same types of concerns. Individual care, patient-centered care. Let's be sensitive. So as I'm speaking to you today, I'm speaking to you from the lens of VA. However, I know that some of you who are on this call are also part of the faith-based community. So as I'm speaking, if something resonates and it's something that you can transfer over to your community of faith, feel free. Because if we're all doing this, then we're making our society better. So let's look at creating a welcoming environment. Use respectful language, inclusive language. What pronoun should I use when I speak to you? How would you like me to say your name? A male can walk into, or what appears when a person appears to be male walks into a clinic with a female, who do you assume is the veteran? Do you assume that the veteran is the male because it primarily service has been attributed to males? Do you assume that it's the female? Check yourself. Assess sexual orientation, gender identity, and sexual health as appropriate. Refrain from those assumptions. It doesn't hurt to ask. Be aware of your misconceptions, your biases, and your stereotypes. And never push anyone to do something that they're not ready to do. You can ask the questions and lay the foundation, plant the seeds. Don't assume that because a person looks male, that they go by he. Do not be afraid to ask what their pronoun is. And not everyone that walks into your facility or a VA needs you to ask what their orientation is or what their pronoun is, because they'll tell you. Some of our veterans are very vocal, and they'll tell you up front how they would like to be acknowledged. What we do not do. Please don't ask a person to educate you on LGBT history or current news. I, all of us have a personal responsibility to learn about the history without asking them to teach us about the history. Don't out a veteran to other people. It is their decision when to come out. We can serve as a supportive mechanism, as an ally, but it's not our place to tell someone's story. You may have heard this refrain before: nothing about me without me. So don't share about me unless I've given you permission to do that. Don't try to convince a veteran to come out or stay closeted. It's not our decision. It is an individual's choice. Let's be there to help them, to support them, not to tell them what to do. And do not attempt to tell a veteran that it's wrong to identify as someone on the LGBT spectrum. I don't know of anyone that would want to be told, don't identify as a mother when you're a mom, or don't identify as an abuela when you're a grandma, or abuelo as grandpa, or any other way that an individual chooses to identify. I want to share that there's no time to give up on human kindness. We have a responsibility to reach out and support one another on our journeys. Of course, we can't do that for every single person, but if you're working with someone, whether it be in the VA or in the community, getting to know the person, building a solid foundation, having trust will afford that person to become a fully realized individual that they are. Now, for some in the faith-based community, consider a safe space, a welcoming space for your congregants. Maybe hosting listening sessions or having a coffee hour where folks can come by and just be who they are without judgment. I want to share with you some helpful websites. This will be on the slides and you'll receive them, but take a look at patientcare.va.gov, mentalhealth.va.gov, modernfamily.org. And then there's another set of slides, and I'll send that out to Mr. Washington and his team so that all of you can have the information. And it's information from GLAAD that talks about religious and faith value programs. And they list all the different denominations and opportunities that the different denominations and faith-based organizations have that support our LGBTQ population, and most especially our veterans and our younger population. So that's the end of my slides, but I wonder if you have any questions for me and if there's anything that I can clarify for you. On the screen is my contact information. Feel free to reach out to me with any questions that you may have or resource information that you may want me to share with some of my teams.
Thank you, Ms. Pittman. That presentation was most informative. Now we will address any questions in the Q&A box to the right of the screen. I will read the questions aloud and Ms. Pittman will provide a response. If we are unable to address all questions, we will make a note of each unanswered question and reply directly back to you via the email address you used when you registered for this webinar. Unfortunately, there's question. Comments. I didn't know the significance of each color of the flag history. So that was the comment. Will the screenshots be available on the PowerPoint?
Yes, so the PowerPoint will, everything that you saw on the screen for my presentation you'll be able to see it on the PowerPoint.
The presentation and VACF BNP resources and materials will be emailed to each attendee. Oh, thank you. Okay. So in the event that any of the questions were missed this afternoon, we will make a note of each unanswered question, like I said earlier, and get back to each person directly with the email address they used to sign up for this webinar. If you need to reach out to the presenter, as Ms. Pittman said, her information, she gave it out before, and we will also have the information for her in our office. And you also have the option of reaching out to anybody in CFBNP for any information in conjunction with Ms. Pittman. At this time, I turn the mic over to Mr. Washington, who will provide some closing remarks.
Well, thank you, Nicholas. I appreciate it. Mary, thank you very much. Very informative information, and some may consider it a sensitive topic, but it really isn't. I would just echo many of your comments as I summarize and just mention to everyone that we are different people. No one looks the same and sounds the same as we walk on this earth. So I think it's important for us to embrace diversity. And we don't have to agree with everyone's choices and decisions, but we can respect each other. And I think that's important. That's the happy medium, is to respect each other. And as a man of faith, and I know I have people of faith on the call, I know that many of you serve in different capacities, but I would say that one of the attributes in the faith that I serve is love. So how do we share love with each other without disrespecting each other and embracing each other? And I think that's important. So thank you very much for joining us today. Mary, I appreciate your information. I want to thank all of you for joining us, and please know that we will be sending information out, the slides. We also have information about our office. And I mentioned earlier about the information for the month of action for the vaccination. We will be sending that out as well today. So thank you all very much for joining us, and you all have a blessed and safe day and weekend. Thank you.
Lastly, everyone, if you registered for this event, we will provide you today's presentation along with the recordings of the webinar. If you would like to take it a step further and visit our website where this webinar will be uploaded, we also invite you to do that. In conjunction, visit our Facebook page where you can follow what the office is doing and be kept up to date for future webinars and information. This adjourns today's meeting. Thank you for joining us today, and have a good afternoon.